So much knowledge, and I am honored to introduce my fellow warrior sister, Patricia Torres Rodriguez.
Good morning.
Good morning.
My name is Patricia Torres. I am a mother to my two beautiful daughters, a wife to the best caregiver I know, and 3 years ago, I became a Medivivor when I was diagnosed with stage 4 metastatic breast cancer. For many people unfamiliar with stage 4 metastatic breast cancer, these words may seem disturbing. We've learned as a society that metastatic or stage 4 is connected to death and dying. Metastatic breast cancer, also known as stage 4 breast cancer, occurs when the cancer has spread outside the breast to other parts of your bodies, such as your lymph nodes, lungs, liver, brain, and even the bones. Sounds scary, right? Stage 4 cancer? I was devastated, angry, and embarrassed. I knew nothing about what this meant. My first thoughts were to prepare for my death. I had no idea this could happen. I cried through all my appointments. I cried at dinner. I cried walking through the streets. Why was this happening to me? I am a caring, giving, and even a spiritual human being. This wasn't supposed to happen. Did I do anything to make this happen? Why me? I was told by the professionals they didn't know. So my journey with breast cancer began 5 years ago at the age of 48 when I was diagnosed with stage 2 invasive ductal carcinoma in situ breast cancer. It started when I went to the ENT doctor to find out why I was having welts on my skin. Turns out it was dermographism, which is when histamine attacks your immune system. At that time, my blood labs showed my white blood cells numbers were off. So I was sent to see an oncologist who really asked me why was I in his office since he didn't see anything wrong with my blood results. I went home wondering what could be happening. Almost 2 weeks later, I was taking a shower and felt a large lump on my left breast. I had been getting my mammograms yearly. What could be happening? I went to the doctor and I was sent for a biopsy, and to my surprise, I was told, yes, you have cancer, but you'll be okay. After 38 treatments of radiation and a lumpectomy surgery, I was sent home with an anti-estrogen pill named tamoxifen, a pill I had to take for 10 years that would prevent having breast cancer again. I was on what the doctors called remission. What does remission mean? To me, it meant I was cancer-free. It also meant to go live my life, exercise, eat better, and try to live stress-free. I never thought I would hear the words, you have cancer again. In March of 2016, 2 years after my first diagnosis, I was diagnosed with stage 4 metastatic breast cancer, ER positive, HER2 negative. I found out by coincidence. I went to the emergency room with an excruciating pain in my abdomen, and no pain medication was taking the pain away. I was given a CT scan to rule out several areas of the pain. When I left the emergency room, I was told it was probably a virus and I should go home and let it ride. About 2 days later, I received a phone call from my oncologist to let me know that she was 99.9% sure my breast cancer had metastasized and I needed to come in right away. I asked her what did that mean, since I had no idea breast cancer could return and no idea what metastasized meant. I told her it's my 50th birthday and I'm on my way to Mexico. Should I cancel it? She said, go celebrate your birthday, but when you return, you will be very busy with many appointments. She wasn't kidding. I felt like I lived at Memorial Sloan Kettering for the first 6 months, between PET scans, blood tests, and even thrown into menopause right away by removing my ovaries. It was all very overwhelming and exhausting. I was then prescribed these wonderful medications named Ibrance and Letrozole that are keeping me alive. Therefore, I'll take the weight gain and the sore muscles and even the tan. I'm alive, and that's what's important to me. I want to make sure that I'm here to see my daughters get married and love to see my grandchildren when they are born. Research indicates many women live for many years with metastatic breast cancer, but it also indicates that more than 42,000 women a year die from it. The survival rate is 5 years, but I met many women who are living 20 years with metastatic breast cancer. So today I'm living with the disease, but progressively getting rid of it with some wonderful meds that are making me gain weight, keeping me fatigued, making my skin look like a tan, and my hair curly. I'll take it because I'm alive. There are things in life that are a choice, but I was not given a choice to have cancer yet again. However, I did make a choice to take my life back and choose how I was going to deal with it. I had a new normal. I started advocating for myself and getting familiar with my disease. I also started attending cancer patient support groups, since those are the people who understand what I'm going through. I attend many conferences where doctors keep us up to date with new medications and clinical trials that are keeping women alive. I attend retreats that help me heal. There are many to name. Taking care of my mind, body, and soul meant doing meditation, eating well, letting go of all negativity, and even try to be stress-free. Many women with this disease keep it to themselves because they don't want pity and they don't want to be judged because they look so well. But I learned not to keep it to myself because that would be too much stress, and I needed to thrive. I needed to learn how to heal. With metastatic breast cancer, many of us don't look sick, since some of us don't lose our hair and even walk around like there's anything wrong. But don't be fooled by what you see on the outside. We are deeply hurting on the inside. I don't live with fear, but I do live with the uncertainty. The uncertainty of when my life will turn upside down yet again. So I pray every minute of the day for giving me life and for giving me the strength to live. To all those who are impacted by cancer, keep believing there is hope for a cure. Embrace the earth by taking a deep breath every day. It is proven to help with the healing. Take your shoes off and feel the earth. Nature is proven to help with the healing process. Take a few minutes a day to yourself and let go of all the negativity. Be your own advocate. For my metastatic breast cancer sisters, keep thriving, keep living. Take care of your mind, body, and soul. Get to know your new cancer community, which is your new normal. Go to a support group, go to conference, and learn about your disease. These are the people who know and understand what you are going through. And as my husband says, live your life. To the family members of these cancer patients, listen to them and enjoy your time with them. Offer to go to appointments with them. Have some fun walks and talks. Most of all, love and laugh with them. Help them thrive to survive. I'm going to leave you with a quote that I'm trying to live by. It's by Rachel Martin. Sometimes you have to let go of the picture of what you thought it would be like and learn to find joy in the story you are actually living. Thank you for hearing my story.